day, everyone, and welcome to this webinar on how to involve patient experts in studies on early detection of cancer. This webinar is co-developed by Rising Tide Foundation for Clinical Cancer Research and LUNGevity Foundation. Both foundations fund clinical cancer research and are dedicated to promoting the involvement of patient experts in this research. In our experience, that involvement may differ between the types of clinical studies. So today we will focus on how to approach it in early detection of cancer. To tackle this complex topic, we have invited an experienced lung cancer patient advocate and caregiver, Mrs. Kristen Kimball. Dear Kristen, would you like to say a few words to introduce yourself?
Hello, everybody. My name is Chris, and I live in Boston, Massachusetts. I am a recently retired faculty member from the Department of Physiology and Neurobiology at UConn, where I taught anatomy and physiology and some other things for over 40 years. I am also the widow of a cancer patient. My husband, Dave Kimball, had EGFR positive lung cancer. He was diagnosed in 2012, and he had 7 years of great survival thanks to research. He was in 3 clinical trials, and he actually was in a groundbreaking trial that established osimertinib or Tagrisso as one of the main treatments for EGFR positive lung cancer. So we're big on research, and I carry on in his honor, actually doing this work. And this is about patient involvement in research, and here I am, not a patient, but a former caregiver. So I like to tell people that in my mind, and in that of many others, cancer is a family diagnosis. It affects everybody. The patient is central, of course, but in the next ring is that caregiver and their family and their loved ones, and family means whatever you describe as family. As caregiver, and that's a silly name because I did not give care. My husband was very healthy through, well, as much as one can be undergoing treatment, had a full high quality of life during his 7 years of survivorship. And, but I had an observed experience watching him go through all his treatments and all his scans, and I shared all this frightening emotions, and I had my own experience. So one of my messages is that we all have something to give, the patients and their care partners too.
Thank you, Kristen. So our first question would be, so why are early detection studies, according to you, important for people with cancer or with a cancer risk?
Well, one of my answers is a little off what you might expect. I would argue that in a way we don't yet have that early detection test. We have low-dose CT scanning. Very few, well, not very few, a lot of people are eligible for low-dose CT scanning and to have it paid by insurance, but it requires an extensive tobacco history, and it requires kind of an advanced age, 50, and at least in the US, that's true. There are restrictions around getting low-dose CT scan. It's not invasive when you look at what we in the US go through for our colonoscopy scans, for example. But there are reasons not to do it for no reason at all. But on the other hand, we need something for the population. Lung cancer kills more people than any other cancer does among cancer-related deaths. It kills more people than the next 3 combined. It kills more women than breast cancer. And yet, while we have screening for everybody, for the other cancers, we don't for lung cancer. So one reason to do early detection studies is to try to come up with something else to either stratify who is eligible for that wonderful low-dose CT scan that can diagnose you early, or to come up with another method altogether. If you catch lung cancer early stage or very regional stage, local stage, it's much more treatable and possibly curable, even curable. And if you catch it late stage, like most are now, over half, then it's much less treatable and curable. So that's the reason.
Yeah, thank you. So what is the benefit of a patient partner involvement on the design and the execution of an early detection study?
Well, the patient is the ultimate consumer. They're the people who are doing the screening, who will benefit from the screening, who will have their lives saved from the screening. So they have opinions that are worth listening to. We're the ones impacted, we're the ones who feel the fears about getting screened and the nihilism associated with lung cancer too. It's both stigmatized because of its association with tobacco, which isn't fair to anybody. And it's also just not talked about more than other cancers. And I think there's a fear associated with screening that's related to that. So it needs to be more acceptable. It needs to be something that we're not as afraid of. I mean, nobody likes getting a mammogram, but you're not ashamed to get it, and it's just accepted that one gets screened for this. And that's what we need for lung cancer. And if I think patients and their care partners can help inform not only what the test might be, but also how one might promote it and get people to take it. Because even among the population that's eligible for low-dose screening now, the uptake is abysmal. I want to say 5% of eligible people in the US who are eligible for screening actually get it. And there have to be approaches on a behavioral level to make it more acceptable and just, oh yeah, of course, this is what we do. It kind of stinks, but actually it's a lot better than a colonoscopy.
So what would be the most suitable patient partner profile for involvement in early detection studies?
And I actually can't answer that, but I can tell you who I think wouldn't be. And one answer to that is the early diagnosed patient and their family, their caregiver. They are fully immersed in self-advocacy now and finding the treatment and finding the cancer center, and they've got way too much going on. So I would avoid that. I think among the people you should look at are the care partners and family members, especially families at risk would be interested. Anybody who's concerned about their family. When you get to a point where you've got your patient or you're the patient and you're on your road, your treatment path, and can think a little beyond for a moment, that's when you might be approachable. You need multiple voices, I think. So perhaps even a panel, several people, include a caregiver, include a couple patients, survivors at different stages, and see which one was able to offer the best guidance. That almost could be a research question, I think. This is a new space for all of us to try to identify. And again, with the idea that eventually we get to a place where lung cancer screening is ubiquitous as other kinds of cancer killer screenings are. We need the help from everybody.
And now last question, what do you think would be the most relevant endpoint for an early detection study or, for patients?
I'm not sure this is the best answer, but it's something for everyone. Amongst the possibilities now, I would say anything that expands eligibility, anything that expands uptake. I mean, we don't have uptake yet so that might be pointing to something other than clinical science. That might be pointing at behavioral science. But as far as translational and clinical science goes, I would say we need more options aside from, and I see it in two ways. We need additional testing, and I know we have looked at blood biomarkers and whether that can be expanded or not. We've looked at volatile organic compounds and breath tests. Can that be expanded or not? I think a more possible option is to look into expanding ways through AI, for example, to expand looking at those CT scans among a bigger population and looking to identify other populations who will benefit. So stratifying, increased stratification so more people are eligible, more people being eligible for some kind of screening.
Super. Thank you so much, Kristen, for sharing your expertise and your insights on the topic. This brings us to the end of this webinar. If you have any question on the topic, please reach out to the either Rising Tide or the LUNGevity team. Thank you.